Welcome to the recorded version of Understanding the Value of Home Care, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care. All right, our presenter today is Lakeland Hogan. Lakeland is the Caregiver Advocate for Home Instead Senior Care. She holds a graduate certificate in gerontology, and she also holds a master's in business administration. And her undergraduate education focused on marketing communication studies. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for the University of Nebraska Omaha's Department of Gerontology and the local area agency on aging. She is also active in her local chapter of the Alzheimer's Association. Lakeland has experience assisting senior clients and helping their families navigate the senior care continuum. She is passionate about helping others, especially aging adults, and their families. And with that, I would like to turn the floor over to our presenter, Lakeland Hogan. Thank you for being here, Lakeland.
Thanks so much, Steve. Hello, everyone. Thank you again for joining us today for the webinar. We kind of have a unique topic, understanding the value of home care. And I chose this topic today because home care can be somewhat of kind of a new addition to the senior care continuum, and sometimes not fully understood, and the value that it brings is not fully understood. So I wanted to present this webinar to you today. It coincides with a new report that's out called The Value of Home Care, and I'm going to give you all the details on that in just a few minutes. But to start the day, I wanted to go over some of our objectives for today's webinar. So first, I want you to walk away understanding the needs of our growing aging population and the older adults' desire to age in place. The majority of the time that's in their own homes. I also want you to walk away with a better realization of the scope of home care services and its benefits to the older adult population. And then I'm going to talk about how home care fits into that continuum of care. And then I'm going to leave you with some tips and resources to help families better understand home care and help them find home care resources. So I'm going to talk to you a little bit about that report that I just mentioned. So as we go through the first part of our presentation, a lot of the information that I'll be covering is based on this new groundbreaking report entitled The Value of Home Care. And it's really the first of its kind and demonstrates the value that home care can provide to seniors, their families, and the American health system, which all equates, to the American economy. And this report was put together by the Home Care Association of America and the Global Coalition on Aging. It really was a collaborative effort of all the major players in the home care industry. And at the end of the webinar, I'm going to share a link with you. So if you wanted to download the report, read it in its entirety, or just find out a little bit more about the statistics that I will be talking about as we go through the presentation, you can get that link at the end and get yourself a copy for your personal review. But let's go ahead and dive into those statistics here on the next slide. And for many of you, these are probably a review. These numbers really illustrate that age wave that we all know is coming, because as we know, tens of thousands of baby boomers are crossing that 65-year-old threshold on a daily basis. So by 2020, 56 million Americans will be over the age of 65. And then if you fast forward to 2050, 84 million Americans will be over the age of 65. And when it comes to that oldest old population, that 85-plus population, by the year 2040, the number of that population will triple. And why these numbers are so significant is because nearly 70% of Americans who reach the age of 65 will need some sort of assistance in the remainder of their life. And the question comes down to, where will that assistance take place? What will that assistance look like? So as I mentioned earlier, the majority of people want to age in their own homes, and the Value of Home Care report found that 9 out of every 10 seniors want to stay at home for as long as possible. And that sounds ideal, but unfortunately there are gaps in the care continuum that are preventing this from happening. So gaps like decreasing number of family caregivers. And I'm sure you're seeing this in your own families. For me, my grandmother was one of 12 kids. My dad's one of 6 kids, and I'm one of 4. So you can see my family size is shrinking, as are many family sizes around the U.S. And some people would say a family of 4 these days are even kind of big. So, that number, that ratio of adult children to care for their aging parents is decreasing. So as of now, there are about 7 potential family caregivers for every older adult. But if we look ahead to 2050, that number is going to shrink to a 4-to-1 ratio. And not only is that a significant number, but there is a growing average distance between family caregivers. So for those over the age of 60, on average, one adult child lives 280 miles away. So many adult children, as I'm sure you're experiencing in your daily life, your work with family caregivers, they're caring for their aging loved one at a distance. And those long-distance caregivers have significant challenges. And that's where the home care industry really has an opportunity to help these seniors maintain their independence at home and fill these gaps that we're starting to see in the family structure. And again, I mentioned earlier, 90% of Americans over the age of 65 want to stay at home. And while there's so many new living options, 10, 20 years ago, a nursing home might have been the only option, the only alternative to aging at home. Well, now we have this whole care continuum. But regardless of that continuum, 80% of seniors think that home is where they will always live. And 60% of households over the age of 80 have lived in their residence for 20-plus years. And the American dream of owning your own home is definitely prevalent in the older population, as 80% of Americans in their 70s own their own home. You might be thinking, why are these last 2 statistics significant? Well, there's a sense of familiarity and community that comes from living at home that's as equally important to older adults as it is to any other age group. And for older adults, there's a sense of pride that comes along with staying in your own home and the reassurance of a familiar neighborhood and community. So while seniors want to stay in their homes, as I mentioned earlier, the majority of them will need assistance at one point or another. So regardless of where seniors will age, whether it's at home or somewhere else, nearly 70% of Americans over the age of 65 will be unable to care for themselves without assistance at some point. The senior may need anything from light housekeeping to personal cares, but 40% of adults 65 plus will need daily assistance. The question is, who is going to be providing for those needs? And many people are turning to home care as an emerging, innovative solution to the care needs of this growing aging population. And it really gives the senior a choice of how and where they age. So now that we've gone through some statistics that show the need for home care, I'm going to dive a little deeper into the scope of home care and the benefits for the key stakeholders. A lot of times there can be some confusion on what home care is versus home health care, and the Value of Home Care report does a really nice job of bringing clarity to this distinction. And I've kind of broken out there on the in the 2 columns on the slide on how they differ. Pardon me. So for home health care, it is a medically necessary and doctor-prescribed care. It's usually performed by a group of medical professionals like physical therapists, occupational therapists, nurses, social workers. And home health is usually for a limited period of time, and the home health visits are task-based. So for example, home health will come in to take the older adult's vital signs or tend to a wound dressing, or they might be there to give a bath to the older adult. So there's not a lot of flexibility in the services that are provided, and these visits are typically short and conclude when the task is complete. And home health care is a primarily covered benefit and is funded by government programs such as Medicare and Medicaid. So if we transition over to the home care column, caregivers are typically not medically certified. However, they do receive professional training that allows them to assist in activities of daily living. And home care does not need any sort of prescription, and the schedule can be customized from as little as 3 hours once a week to daily assistance or even 24/7 care if needed. And home care is primarily paid for privately by the senior or their families. So next, I'm going to give us a little snapshot of, again, the scope of home care. And before I move on, I don't want to I don't want you to all think that I'm saying that home health care is bad or home care is bad, because we really work hand in hand together to provide for all of the seniors' needs. Again, just trying to make that distinction between the two, because sometimes the terminology is kind of switched around. So again, they serve a very specific and important purpose, but I want to make sure that by the end of the webinar that we're really clear on the distinction between the two. So next I'm going to show you another little chart about the scope of home care services. So in most states, you can see on the screen, those are the list of services that we can provide. And I say this because there are a few states that limit the scope of care, but really that's not the norm. Most states, you can, as a home care agency, you can perform these activities of daily living and these instrumental activities of daily living. So you'll definitely want to check with the regulations in your specific state. But in general, home care services can assist with those activities of daily living. So I have them listed there: eating, dressing, bathing, toileting, transferring, continence and incontinence issues, and grooming. And they can also help with those instrumental activities of daily living: driving, meal preparation, light housekeeping, shopping and errands, managing finances, administering, helping with kind of some administrative tasks around the house, organizing bills, helping make appointments, and then medication reminders, and can even help them manage the telephone. I know a lot of seniors, in my previous webinars I've talked about how seniors get a lot of those fraudulent calls, that sort of thing. Home care can kind of help screen for those as well. So in addition to all of this, caregivers can also provide companionship and mental stimulation by engaging seniors in conversation and activities, and they can act as a second set of eyes and ears for the family. And they're able to recognize and alert family members if there are signs of declining health. So when making the decision to hire home care, it's important for families to understand that there's a difference within the home care world. There are registries and agencies. So a home care agency is one that will screen, hire, train, and support their employees, and they're considered W-2 employees. So agencies take care of payroll and taxes, all of that sort of thing. Insurance, bonding them. On the other hand, registries more so just connect families with contracted individuals. And it's important to communicate the difference with the families, as there are pros and cons to each. They definitely do have some distinctions. And I'll give you some resources again at the end of this webinar that you can give to families to help them better understand. And home care is not only a benefit to the older adult, but there are additional stakeholders that home care benefits, and so we're going to dive into those different stakeholders next. So like I mentioned, in addition to that senior, home care also benefits the older adults' families, and it also can benefit the American healthcare system and the economy. So this Value of Home Care report, I'm going to share some statistics with you. They've done their research and have proven that home care can really be a benefit to the American health system as well. So we're going to start by looking at the benefits to the senior specifically. So one of the major benefits of having home care for extra assistance in the home is that it can help to reduce falls. Falls are the #1 cause of ER visits for seniors over the age of 65. And people are twice as likely to fall at home than anywhere else. And falls can happen while attempting simple household tasks, such as carrying the laundry down the stairs to the basement. So home care caregivers or employees can complete these types of tasks or help with them to prevent accidents in the home. Another benefit is keeping seniors healthy, and that's really done in 2 ways. The first is ensuring that medication regimens are followed, which is crucial, as 40 to 70% of seniors reportedly make a medication error. The second is caregivers help seniors by preparing nutritious meals and can help maintain a healthy and balanced diet. They can also encourage physical activity, whether it be encouraging those physical therapy exercises that were prescribed, by in the home health side of things, or they can simply just encourage a walk on a nice day. So home care can, again, contribute to a healthy life of a senior. And then it also provides companionship and helps seniors remain connected and engaged, which in turn prevents social isolation, which I've been reading a lot about this lately, and social isolation in the older adult population is a major concern. So let's look a little bit closer on the next slide. So as you can see on the screen, 43% of seniors report regularly feeling lonely. One study found that those over 65 were 59% more likely to decline if they reported being lonely. And 45% have a higher likelihood of dying than those who are not satisfied with their social lives. So these statistics really show you that isolation can lead to the decline of a senior's health. It can lead to lower life satisfaction. So that social interaction really can make a huge difference in the life of the senior that the home care agency is providing care for. And for many, transportation was their connection to their social lives. I'm sure many of you have heard, just as I have, that seniors feel like once their driving abilities are taken away from them or they have to give up driving, they feel like they're no longer going to be able to connect with that social calendar that they once had. And actually 21% of seniors reported missing out on socialization due to transportation limitations. So when I'm talking to families about that conversation of taking away the keys, I always talk to them about making sure that when that conversation happens, to have alternative modes of transportation for their loved one so that they don't feel that social isolation. So not only can home care provide that social interaction and companionship, they can also transport them to their social activities so they no longer have to miss out on the church potluck or Wednesday night bridge club. And in a lot of ways, home care professionals become an extension of the family, as they can be an extra set of eyes and ears for family members, as I mentioned. So we're going to take a closer look at the next set of stakeholders, which is the family. So more than 34.2 million Americans serve as a family caregiver for someone over the age of 50. On average, family caregivers spend 24.4 hours a week providing care. And if you think about it, that's pretty much a part-time job. And the impacts of caregiving responsibilities on families is profound, and it can really take a toll. 19% of family caregivers reported a high level of physical strain as a result of their family caregiving tasks. And 70% reported symptoms of depression. So many family caregivers today are, in addition to these caregiving duties, are still working. 60% of them, actually, of these caregivers are still in the workforce. However, 61% report having to make workplace accommodations. And those are things such as coming in late, leaving early, taking additional time off, Maybe they even cut back on their work hours. They might pass up a promotion, or they might end up retiring early just to care for their aging loved one. And there's also a greater chance for caregivers to have health problems if they are working. 25% of these working family caregivers have high blood pressure, and 50% experience daily physical pain more so than their non-caregiving coworkers. So these are some impactful statistics. As the role of the family caregiver can certainly be challenging, it can create a lot of stresses, physical, emotional, financial stresses. And I'm sure many of you have worked with a family caregiver. You might have a coworker who's also a family caregiver who have had some of these experiences, or maybe even you yourself are a family caregiver and your own career has been impacted. So these, again, are some significant statistics. And we know that when home care is in an older adult's home, we're not only helping the senior, but we're also helping the family as well. And I have a few more stats here on the next slide about the family caregiver. So home care can help reduce the burden experienced by the family caregiver and enhance their productivity, especially for those working family caregivers. So due to older adult caregiving, there is $34 billion, that's with a B, billion dollars, in total productivity loss annually. And that's an estimate, but still, that's a lot of money lost for the productivity loss. And home care can elevate the caregiving tasks, save the family caregiver's time, and allow them to stay on the job, miss fewer days of work, and stay focused at work. So hiring home care can also reduce those health and stress-related issues that those family caregivers are having, which is projected to save $13.4 billion in annual health care costs. So if home care is in the home, that's telling us that family caregivers can be more productive in their jobs and stay healthy long enough and stay healthy enough to stay on the job and remain employed, continue their work. And in this report, there was one caregiver from North Carolina that was interviewed, and she said that having home care made her feel more comfortable because she knew she could go to her job and not have to worry about her loved one at home while she was trying to work. So home care can really provide peace of mind for family caregivers. All right, and there's one more stakeholder that I mentioned earlier, and that is the American healthcare system. So we're going to take a look at that here on our next slide. And as we all know, there have been many changes in healthcare over the past few years, and especially right now, it's kind of all up in the air. But it has transitioned from a fee-for-service model to a best outcome model at lower cost. Best outcomes at lower cost model, pardon me. So this new model has the opportunity for home care to really make a difference in the lives of patients and their families. Home care can improve the physical and mental well-being of the care recipient by preventing falls, keeping seniors on track with their medications, providing nutritious meals, helping them maintain personal hygiene. And caregivers can also provide doctors with valuable information that might help improve their diagnosis or treatment of seniors. I'm sure you've all experienced going to the doctor's office with an older adult, and they might not tell everything that's going on, or maybe they have some sort of mild cognitive impairment, so they're not able to explain to the doctor all the issues that they're having. And so often the caregiver can jump in and provide some extra insight on the things that they've observed in the home. So as your statistics on the screen highlight, there are some things that home care can do that benefit the healthcare system. So for those using home care, they had 25% fewer doctor's visits. And of the patients with dementia, there were significantly less hospital admissions. So having that extra set of eyes and ears in the home can really help to reduce those admissions, those doctor's visits. And as I'll walk you through here in a little bit, it can really reduce those unnecessary doctor's visits or those unnecessary hospital readmissions. So I just have a few more statistics here on the next slide in terms of how home care can benefit the healthcare system. So in addition to improving the health of the older adult, Private pay home care can also provide a more cost-effective option for long-term care. By promoting better health and well-being among older adults, home care services reduce public health care costs. So if you just take a look at these numbers here on the screen, home care provides significant relief to the healthcare system, including the cost of long-term care and government-funded programs. And as you look at the annual cost of long-term care, home care is clearly less expensive of an option. It's about the half of the cost of annual nursing home. And recent data shows that more than 60% of national spending on nursing home care is paid by Medicare and Medicaid and other public funding. So even if a fraction of that could be redirected to home care, it could really save billions to the U.S. healthcare system. And there's a lot of concern about, as the boomers age, that our government-funded programs might be stretched a little thin. So home care can really kind of provide some relief to that. Okay, so that's kind of a good summary of that value of home care report and all of the benefits that home care can bring to the healthcare system, to families, and to seniors. And now I want to switch to one of those next objectives, which is illustrating how home care can fit into that continuum of care, which will hopefully, by the end of my explanation, show you the true value that home care can bring. So Homestead completed 2 readmission prevention studies, and I'm going to go over those studies with you here on the next slide. So the basis of these studies centered around patient compliance with discharge instructions, along with monitoring of key quality outcome indicators in the home. And the hope was to show that there was a correlation with the reduction in unnecessary hospital readmissions. There's a correlation between that and having home care in the home. So we set out to show the true value of home care by doing these studies. So the first study was in Richmond, Virginia, and it was a large for-profit hospital system. And our goal of this study, in addition to the one I mentioned there on the screen, we also wanted to reduce hospital readmissions by 1%. And their hospital readmission rate at that time was 16%. So in this study, we had 55 patients, and the primary diagnosis was CHF, congestive heart failure. So that was the first study. Our second study was in Michigan. It's a suburb of Detroit. And this was conducted in 2 large nonprofit hospitals. And the goal was for this pilot to prove out patient compliance and self-reliance. So in that study, we had 30 patients in the pilot, and the primary diagnoses were CHF, again, congestive heart failure, and COPD. And both of these were based on a 30-day plan of care. So I want to kind of walk you through our, how we integrated the discharge planning into this whole study. So discharge planners completed a risk assessment on all eligible patients, and we then joined with the discharge planner while making a home plan and assisted with the home risk assessment of the patient and their living environment. So as a team, we determined the level of care and the hours needed in the home and created an individualized care plan incorporating the patient's needs and goals. This means we were involving the senior throughout the whole process to determine what their true goals were and to create that initial home care plan to accomplish that patient-centered goal, yet still meet that medical discharge plan. So we were present at discharge to hear the instructions and to ensure that the client understood the program. And we found that our presence actually built an additional layer of trust with the senior, which really increased our chances of success with these studies. And we employed a method of teaching the patient how to engage in their care and understand their condition instead of handling all of these cares for them. We also made sure that medication was available at discharge and reinforced the medication schedule and the education around the medication schedule at discharge. And what resulted was really an individualized care plan. So the care plan focused on patient-centered goals with an action plan. You know, those functional goals of they want to be able to drive again, grocery shop, get to a wedding, garden in their yard, those types of things. And then the caregiver was also present at discharge, and this really clarified the discharge instructions, assisted the patient in understanding the home care program, and again, built that layer of trust between the patient and the caregiver. We also used the teach-back method to empower the patient in their care. And we referred back to the patient education and discharge instructions just to help reinforce that message. And we asked about their tasks instead of telling them what to do for the task. So we were helping them do the task first and then assist as needed. So again, helping them to get in the habit of doing the activity on their own. And then when it came to that medication management, we made sure to do a reconciliation from discharge with all of these physicians involved and made sure that the medications, again, were available in the home at discharge and made sure that the patient was educated on those medications. So to show you kind of what these care plans look like, I'm going to pull up a graphic here. So each plan was really, again, individualized for the patient's needs and wants. So this is just kind of an example. This wasn't, this is pretty standard, but some of them were adjusted based, again, on the patient's needs. But it would start with a minimum typically of about 1 hour of care for 5 visits in 1 week, and then we decreased the hours after the first week. And since we were using the client teach-back method, it allowed the patient to really learn and learned how to recognize issues and helped them gain confidence on their own care and allowed us to really taper back our hours of care with the decreasing need. So teaching the patients in this manner really increased their competency and their confidence as time went on, and we were able to cut back on the home care visits. And each week the team met to discuss the current plan of care and determine if the hours needed to be adjusted really based on the client's response. So, are you ready for the outcomes of the study? We were excited by these results. So, both studies we were able to show a tremendous improvement. So, the goal on study number 1 was to drop the readmission rate 1%. Again, their current rate was 16%. And instead, we showed a 21% reduction. And what surprised the hospital system more so was the result that 58% of the clients were better than the other hospitals in the system in terms of their readmission rate for CHF patients. And then most importantly, we showed that there was 97% improvement upon the nation's readmission estimates for Medicare CHF patients. So we really found improvement when we took the time to sit down and really dig in with the medical team and the patient on their care plan. It showed some pretty good results in that first study. Now when it comes to the second study, we found that there was 93% of our patients who were discharged to their own homes remained out of the hospital. So, and that was again at that, and then 96 remained out of the hospital for 30 days. So, overall, 93% of our patients were able to stay at home. And then 96% remained out of the hospital for 30 days after discharge. And then we continued to really follow them because we were interested to see, at 60 days and 90 days, what were the results. And at 60 days, 93% had remained out of the hospital, and at 90 days, 90% of the patients had remained out of the hospital. So it really showed that this teach-back method and that extra set of eyes and ears in the home, having home care in there, really maintained their independence and was able to carry them through that 90-day period. And not only did they stay out of the hospital, but when they were surveyed, 100% of the participants agreed that they understood their care and felt better than they did in the past. So from the results of these two studies, we were able to identify critical components for success. Let's look at that here on the next slide. The clients were able to gain confidence, knowledge, engagement, and achievement through these bulleted points here on your screen. So really, we were promoting appropriate nutrition and diet, helping them follow a prescribed diet, making sure those nutritious options were available in the home, ensuring that the patient had knowledge and the ability to monitor their diet, their vital signs, their warning signs of their condition. We also made sure that they were getting the follow-up that they needed, those physician's appointments, scheduled testing, and we ensured that they attended their primary care appointment in the first week that they went home. And then helped order testing and helped ensure that their therapies were being completed as prescribed. And then we helped to organize the patient's medical records at home. And of course, that's really important in case of an emergency and for just the patient to have those medical records and have that confidence knowing that if they ever needed it, it was there. And the effects of this went beyond the patient themselves. It really helped to decrease the family caregiver stress that would have otherwise be put on the family caregiver. So in both studies, we were able to fill the discharge gap in education and compliance. In addition, we handled many of the responsibilities that are often assumed by those family members. So home care services decreased the family caregiver stress and gave them more time for other aspects of their life, including freedom from home and workplace conflicts. We talked about earlier that's often an extra stressor for these family caregivers. And family caregivers missed less work and could focus on other elements of their lives, yet remained informed about their loved one's recovery status and confident that they were receiving the needed support. So there really is true value in having home care in the home. But let's face it, some families are reluctant to have home care for one reason or another. So I wanted to give you tools and resources and really talk to you about how we can communicate with families the value of having home care in the home. So we'll transition to that on the next slide. Whenever I'm working with families, I use a short acronym to help with family communications. And if you've tuned into my webinars before, you might recognize this. And I know sometimes it seems silly, but we always want to make sure that when we're talking with families that we use this ACT acronym. So we need to have the families assess the current situation, consider the options, and then talk about the best option for the older adult, and to include that older adult in the conversation. So when it comes specifically to home care, it's important to communicate to families when home care versus home health care is needed. I know that, again, that's often sometimes confusing for families to grasp. So I've come up with these little visual aids that you can use when talking with families. So when talking about that home health care need, this is, again, a nice graphic to share with families, and I'm going to share a resource with you at the end that has these graphics that you can download from the internet and use. Anyway, again, it's a nice graphic to share with families to help them understand the scope of home health care. And that, again, that home health care need could be when they are transitioning home from rehab, or if they need occupational therapy, physical therapy, that wound care, IV care, and so forth. So then on the next slide, I have a graphic for when home care is needed. So I always explain to families when I'm talking about home care versus home health care that home health care, will be coming over to, do those more task-based items like wound dressings or doing the physical therapy. And then I ask the family, but once that home health person leaves, who's going to help with the cooking, the laundry, the transportation? Who's going to get the mail? Who's going to help you get up and dressed in the morning? Who's going to help you with bathing, making sure you're safe during that process? And that's where home care can come in. And so again, this graphic here is nice to really illustrate all the different things that home care incorporates and really make a clear distinction between the two. And I know a lot of times the elephant in the room is how much will home care cost? And again, that's another barrier for families when choosing whether or not they want to invite home care into their homes. And it's hard to have that conversation, but we talked earlier, 90% of seniors want to stay in their own homes. So when we're talking about the different options of staying in your own home versus moving to a care facility, I have a graphic here on the next slide that will kind of help you talk to families about the different average costs. So when it comes to the cost, these are national averages. And this information comes from Genworth. They're a long-term care insurance provider, and each year they do this long-term care study. So that's where these numbers are coming from. And keep in mind, again, that these are just average costs. It might be higher or lower depending on what area of the U.S. that you're in. But when you look at these numbers, there's a lot of alternatives out there. You know, that home care, home health, adult daycare, assisted living, skilled nursing facility. And I also have moving in with a loved one. And I don't have a price there because it's really different for every family situation. But if a lot of families do consider moving their loved one in with them. And there's some important things to consider, different costs to consider when you're thinking about moving a loved one in, like food, clothing, you know, their daily expenses, entertainment, grooming. You know, if they have a pet, that's an added expense. The gas and transportation costs, health care, prescriptions. So that's why I couldn't really put a number to that exactly. But again, when we're talking with families about the different options, we want also cost is always part of that conversation. So I did not want to leave that out. But again, when you look at all these costs, having home care in there, you know, even if the senior just needs it a couple times a week, could really prolong them having to move into an assisted living or skilled nursing facility, and in the long run, saving the family some funds. And again, we need to use that ACT acronym when we're talking with families about these decisions. And I have some questions on the next slide that will help you in talking with families. So when we're in that assess phase, assessing the older adult's current situation, I know there's a lot of questions on the screen here that you can use in that assess process, but there are two critical questions that I believe really need to be asked, and that's, what does the older adult want to do? And then, what is best for the older adult? And the answer to those two questions, in some situations it might be the same, and in some situations it might not. So the senior in some situations might want to stay home, and for some that was a very realistic option. Some, it might not be realistic. And if so, we need to figure out why. Is it a solution where we can bring in those outside services to provide that care? Or, you know, are they kind of far beyond that and they really are at the level of a skilled nursing facility? So that's, again, where it might be a little difficult to have those conversations, but at the end of the day, the senior should be involved in that conversation. Their wishes should be heard and acknowledged, and if we can honor their wishes, we should try to do that to the best of our abilities. And again, I have quite a few questions up there, and this is mainly geared at for those that want to stay home, because as I mentioned, the majority of them do. So, you know, if they want to stay home, what kind of changes will need to be made to their environment for them to be safe? You know, if they had to move, where would they like to move to? So again, getting families talking, assessing the situation, considering the options, and then talking about the next steps and the actions that they're going to take. That ACT acronym, it's kind of a mouthful, but it'll really kind of help with that conversation. So to sum it all up, there's a lot of options out there for seniors when it comes to aging. And the bottom line is that most seniors want to stay at home as long as possible. And so we as professionals in this field need to provide families with a multitude of resources. So if a senior wants to stay at home, they can do so safely. And then give them resources for when staying at home is no longer an option. But home care can bring a lot of value to the older adult. You know, it can reduce that social isolation, help them remain independent, and stay at home longer, prolonging a move. And then it helps the family. It reduces that caregiver stress. It's that extra set of eyes and ears in the home. And then it can really impact the overall American healthcare system and those systems that are really being kind of stretched or will be stretched in the coming years due to the large age wave that we all know is coming. So at the end of the day, again, we need to talk to the senior, the older adult, ask them what their wishes are, and do our best to help families get the resources that they need to honor those wishes. Because, when I get that age, I want to be able to voice my own opinion. So if we put ourselves in the senior's shoes for a minute, it really kind of helps us see it from their eyes. Wouldn't we all like to have the options of when and how and where we will age? So I know I have had a lot of information flying at you throughout this entire presentation, but I did want to leave you with all those resources that I've been mentioning throughout the presentation. So for home care services, of course, Home Instead has home care. It's always good for families to do their research, interview a couple different home care companies, and see which one is the best fit for them. And then on caregiverstress.com, the Home Care Solution Guide, that guide has those little when home care is needed, when home health care is needed graphics. And it's a really long URL. I apologize. But if you go to caregiverstress.com and just search on that page, Home Care Solution Guide, it'll pop right up. And you can download that PDF. You can send it to families. You can print off copies and share it. It's a free resource. Again, it really helps make that distinction for families and help them to realize the value that home care could bring in addition to that home health care that they might be having as they transition out of the hospital, out of rehab. And then the Funding Solutions Guide. Those numbers, that Genworth study that I mentioned earlier, those numbers are also in this Funding Solution Guide. And it helps families look at all the different ways that you can fund home care, because I hear time and time again from social workers, discharge planners, the struggle is getting families to realize how they can pay for home care services, and for those that can't pay, what are the options? So that Funding Solution Guide is extremely helpful. Again, the URL is a little wonky, I apologize, but it's on caregiverstress.com. You can find it there. And if you want to download that Value of Home Care report, you can go to the Home Care Association of America website. It's there for you. And then, as we're having these conversations with families, if we can encourage them to set up an action plan for successful aging, if we can get them to talk about all aspects of aging, that family will be better off as they continue to make decisions for their loved one down the road. So on 4070talk.com, you can download an action plan for successful aging. It's a PDF, so you can give that to families as a resource for them to talk about all aspects of their aging process, their wants, their wishes. And then finally, if you wanted to read in more detail about those readmission prevention studies that Home Instead did, you can visit homeinstead.com/whitepapers. You can download those and read a little bit more in depth about those pilot programs that we did, and you can find all that information there. So again, I know it's a lot of resources, it was a lot of information, but I hope that you're able to better understand home care and the value that it can bring to an older adult and their families. So with that, Steve, I'll pass it over to you for some questions. And I apologize, Lanita couldn't make it with us today, or couldn't be here with us today, so it'll be just me answering questions, but you can always, ask any questions that you would have asked Lanita, and I'll try my best to answer them.
All right. Fantastic. Thanks a lot, Lakeland. A lot of great information. Yes, as Lakeland just mentioned, everybody, it's time for the Q&A portion, so send in your questions to Lakeland here about the great information we've been talking about here, and we will get to it right now. I got a couple similar themed questions that I'm just going to kind of bundle together under one umbrella here for you, Lakeland. Okay. The question in general is, what about home health care workers working with people with dementia? How much training does someone need? What are some of the things to expect? Can you talk a little bit about that?
That's a really great question. As the prevalence of Alzheimer's and other dementias is increasing in the older population, it is important when you're interviewing, a home care provider that you ask, do you have caregivers that are trained in Alzheimer's and dementia? And really, I can only speak for Homestead, but we have an Alzheimer's training. It was kind of blessed by the Alzheimer's Association. It's I think a 5 to 8 hour class on Alzheimer's and how to look out for, signs that they might be getting agitated or frustrated, and in those situations, how to redirect them to kind of minimize those behaviors that are occurring. So it is really important to ask that question, do you have care providers that are trained in dementia? Because it takes an additional skill set, really, to provide care to an individual. And I know on helpforalzheimersfamilies.com, I didn't have that as a resource on my resource page, but again, it's helpforalzheimersfamilies.com. Home Instead has put up their training on there that anyone can take for free. So if you are a care provider, or if you are working with a family who may be hired through a registry, they just got connected with a care provider and that care provider is needing some additional education on Alzheimer's or dementia, feel free to send them to that website to get more information. But I would certainly say that asking about that, especially if the individual has, that moderate to advanced Alzheimer's, then that's going to be really key. And it's also important, I think, for a lot of home care providers to kind of have a general knowledge of Alzheimer's and dementia. So if their client is exhibiting some of those early signs, that they can, again, be that extra set of eyes and ears in the home, alert the family, alert the home care agency that, this individual might need a doctor's visit to get a screening. There might be some cognitive impairment that's starting to develop over time. That's a great question.
Okay, and Lakeland, you were talking a little bit before about the big elephant in the room, and this next question refers to that. The question is, are there any financial resources available to seniors to help pay for home care if they're not able to afford the private pay fee? So can you talk about possible financial resources that are out there, or, everybody knows that this stuff costs a lot of money. What do we do for people that can't afford it, or they can afford a percentage of it, or can you talk about that a little bit?
Yeah, I certainly can. And it is the elephant in the room. I know a lot of times, I've seen a lot of different situations when it comes to this. Sometimes if the senior is unable to afford care, sometimes their family members will all chip in to provide care. I know one of our franchisees, I think he said about 40% of his client base, the children are paying for the care. So I know that's not an option for every family, but sometimes that can be one resource. Long-term care insurance, if the senior has that, a lot of times that can cover services like home care in the home. If the senior was a veteran or the spouse of a veteran, check with the VA, the local VA, to see if they qualify for any home care services. And then there is a Medicaid waiver program for some home care type services. For example, like light housekeeping or bedding. So again, it might be a more limited amount of time, but that Medicaid waiver might be something that senior would qualify for. And at least at the local area agency on aging that really kind of works with that program, some of it is on a sliding scale if the senior can afford a little bit of it. There are also grant programs out there. The local Alzheimer's associations across the nation, a lot of times they'll have grants for those with Alzheimer's or dementia that are needing home care. So reach out to them. And then on that Help for Alzheimer's Families website, there's also a great grant program that individuals can apply for there for those specifically caring for someone with Alzheimer's or dementia. So there are some resources out there, and I would again direct you to that funding solutions guide. I might have forgotten one or two other payment options or resources that are listed in there. So again, on that resource slide, if you can download that funding solutions guide, it'll give you some additional resources in that aspect. But that's a great question. Thank you.
All right, great. Next question, Lakeland. Sometimes loneliness is part of depression. What does an in-home caregiver do if they think their client has clinical depression?
That is a great question. You're right. Sometimes those two can go hand in hand. And again, I can only speak for Home Instead, but we train our caregivers to report that kind of information to their home care agency, and then the agency will reach out to the family to suggest, we've noticed that your mother is, not engaging as much as she used to. She's not eating as much. Those types of things. We try to stick to the facts. You might want to go to the doctor and see if they can maybe screen for some depression, that sort of thing. But yes, that is a good point. But in our world at Home Instead, we train our caregivers to report that information to the office, and then the office will reach out to the family. And then, we can help drive them to the appointment. The caregiver can, of course, give the doctor some information if the family okays it on what the caregiver has been noticing in the home. But yeah, that loneliness, it can really be, not only is it just sad and lonely, but it can also lead to that decline. So that's one of the major benefits of having home care in the home, that regular caregiver, that smiling face that shows up at the door. Maybe it's every Tuesday. We find that the older adult really looks forward to that visit, that companionship, that time together, and it really kind of brightens their day. So again, it kind of gives them something to look forward to. It, reduces that loneliness, and for some, can even reduce that depression. So that's a good question.
All right, and this next question kind of relates to what you were just talking about having that person there, the individual. This next one is kind of about continuance of care. The question, what do you do when an agency for a client is using different caregivers providing care to the one client? It seems if a client's caregiver keeps changing, it is hard to constantly re-educate each client, or each caregiver, on how to work with the client. Can you talk about that a little bit?
Yeah, that is a challenge. Now, I don't know the specific situation. If somebody has, 24/7 care, due to labor laws, we can't have the same caregiver in there 24/7, 7 days a week. So, and again, I can only speak for my organization, but we try to set up a regular schedule and have a good communication system in place where all the caregivers are given the information that they need to provide the best care. Now, if this individual only has care 1 day a week and the caregiver is changing every single time, that isn't, I think, a valid issue to bring up to the agency. There might be a variety of factors that play into it. And again, I don't know the exact situation, but we do at least at my organization work towards that continuum of care to try to get a regular schedule that's scheduled out so that they can build that relationship. But if you are having issues with an agency that you're working with, I certainly would bring your concerns to the agency and talk about, maybe there's a strategy, maybe there's a reason why the caregivers don't want to come back. So, or it could be a personality conflict. So trying to get to the root of the issue, and maybe it is that the agency doesn't have enough staff and they can't continue to have the same person, but really every situation is different. So I think it, again, comes down to having the conversation about, okay, what is the situation here, getting kind of all sides of the situation before we jump to any conclusions or before we can really make a successful action plan going forward. So I think, yeah, that's probably the best advice I would have is get all sides of the story and then go from there. So thank you for that question. I hope that helps.
All right, Lakeland, well, we are just about out of time here today. We reached the end of our hour, but I want to thank you for a great presentation and for joining us today again this month, and thank you so much.
Thanks, Steve. Have a good one. Bye, everyone.